Welcome back to Local Doctors on Call. And in this segment, I want to talk a little bit about herbs. Of course, that's a big focus over at the college. And are there different types of herbs for pain and traumatic injuries? I know that it runs the gamut. You have a lot of to choose from.
There are. So some that most people know is we use a pill form or a raw form, and it makes a tea. But what many don't know is that we have liniments, kind of similar to like a tiger balm, you might say, where you can rub it on, and it helps bring blood flow to the area and heal areas that have been injured or damaged. We also have what's called a ditta, which can be eaten, or we use it a lot as a liniment again. And then we have plasters that we can place on. So these plasters feel similar to like an icy hot patch.
Okay.
But they're packed with herbs which help bring that blood flow or do what we need it to do in
And you mentioned
cases.
this ditta liniment. What does it taste like?
Well,
how would you compare it, I guess, for folks who aren't familiar?
have you ever tried ditch water? I'm just saying. No, I'm kidding. If you think about you were a kid and you had castor oil, what didn't taste good, but the Chinese have a belief if it tastes good, it's not doing what it's supposed to do. So it's medicine. Chewable ditta is a trauma-based form. It comes in a pill form. You don't chew those. There's a little chewable type. Looks like a kind of a little, if you took a Tootsie Roll, roll it up in a little ball.
Okay.
And it is chewy. It's not unpleasant. I've had it often. It's not unpleasant. But it's an internal healer. So we can apply it topically, or you can, in the case of a real severe trauma, you blew out your knee, you sprained your ankle, you had a fracture, you take it immediately, and it begins to speed up the healing process. It's been around, again, for thousands of years, and it's very effective.
And would this be a regimen that you would take over time, or would this be a once?
Over time, but as per needed. As things start to heal, probably the most critical time, let's say a fracture, in the first, say, 3 to 4 weeks.
Yeah, definitely.
All right. Well, don't go away. We have much more Local Doctors on Call after this.